Recently, a doctor in Assam was mercilessly punched and kicked by the relatives of a COVID patient who had died. This is one of the many instances of violence against doctor in India in recent times. One of the commonest reasons for Indian doctors considering relocating abroad is violence against doctors in the workplace. Many young doctors and medical aspirants are wondering if they did a blunder by opting to choose medicine as a career. In this video, I am going to compare the violence against healthcare workers between India and in UK and try to offer some practical solutions about how we can improve the situation. The Health and Safety Executive, which is one of the UK government regulatory bodies, says violence at work is any incident in which an employee is abused, threatened, or assaulted in circumstances relating to their work. This can include verbal abuse or threats as well as physical attacks. In last 1.5 years, COVID-19 has brought fear, uncertainty and anxiety among people in an unprecedented fashion. Healthcare professionals around the world work tirelessly to serve humanity, all the while battling with these emotions. At one hand, we see the society praising the efforts of doctors by calling them COVID heroes, and on the other hand, we see these instances of a mob beating up the doctors for a perceived negligence in their delivery of care. Unfortunately, it does. Nearly 15% of respondents to the latest NHS staff survey covering 2020 reported experiencing at least one episode of violence from patients, their relatives, or other members of the public. A BMA survey in January 2020 found that 43% of 602 doctors were concerned about physical violence and verbal abuse from patients at work. And 32% of the doctors believed that incidents of violence and verbal abuse had increased in the past year. And 43% of 644 doctors saw physical violence or verbal abuse towards colleagues. The main issues related to these incidents of physical violence or verbal abuse were discontent with the service provided, health related or personal problems like psychiatric problems, and being drunk. Of 1251 doctors who responded to a survey done by Medical Protection Society, which is one of the medical indemnity provider for doctors in UK, last year, they found 30% had been verbally abused by patients or relatives while at work during the pandemic. Another 5% had experienced physical abuse. Violence against healthcare professionals in India occurs in the form of physical violence, verbal abuse, aggressive gesture, blackmailing, mob lynching, or even cyberbullying. The Indian Medical Association has reported that 75% of doctors face verbal or physical abuse in hospital premises, and fear of violence was the most common cause of stress for 43% of doctors. The highest number of violence was reported at the point of emergency care, and 70% of the cases of violence were initiated by the patient's relatives. The main reason attributed to violence against healthcare staff is the absence of adequate economic investment in healthcare. Healthcare accounts for only 1% of GDP of India. There are many small, disorganized and healthcare facilities which provide healthcare to a lot of small towns and villages. Poor mechanism of grievance redressal in the hospitals, poor communication skills of the healthcare workers including doctors, poor resource management in the emergency setting. For example, fewer drugs, fewer facilities for investigations, poor doctor to patient ratio and high patient load, political interference in hospital affairs. In addition, the high expectations of the public and their perception that all services should be available free adds to this problem. The main source of stress for doctors was fear of violence, followed by fear of being sued. 62% of doctors who answered a survey reported that they were unable to see their patients without any fear of violence, and 57% had considered hiring security staff at their workplace. These incidents put the medical community in a state of fear and regret for choosing a career when the society does not support them. A majority of doctors are now unwilling to motivate their children to pursue this profession, which was once revered by the society not too long ago. What can we do to improve the situation? We can focus on improving the communication skills of the doctors, and the training should start from the medical colleges, because proper communication can allay the situation and diffuse the crisis. The government has a very important role to play. Hardly 33% of the healthcare expenditure is borne by the government and the rest by the patients themselves. Low insurance penetration is another factor. Unexpected healthcare expenses often push families into a trap of debt and financial instability. Improving the infrastructure and healthcare spending is also another very important aspect of the government's role. The government also has to ensure strict enforcement of laws to protect healthcare workers. Now, what can the doctors do to help this situation? They have to ensure that they communicate in a very lucid language. They involve the patient as a partner in their delivery of care. They need to make sure that they consent for every medical interventions and document everything that they are doing and they are discussing with the patients and the families. This is easier said than done. Hospital as employer for doctor must ensure zero tolerance against violence in the workplace. This might involve initiating police or legal actions against the perpetrators, continuous CCTV monitoring of the hospital premises, and to offer legal support for their employees. The employers must have a legal duty to ensure, so far as reasonable, the health and safety and the welfare at work of their staff. The patients and relatives must understand and play an active role in their treatment decision along with the doctor and the treating team. They need to understand that the doctors are not gods, and there will be situations when their loved ones will not recover from a serious illness. This situation must change, and the change must come from within the people and within the society at large in their perception towards the doctors. To tide over this crisis, the government agencies must work in tandem with the public to abate their fears, to make them realize the criminal nature of vandalism and violence in a hospital. If the situation does not improve, significant number of Indian doctors will lose their morale and some of them will decide to move abroad for a safer work environment. This will be a loss for the country. I hope you have liked this video and let me know your thoughts in the comments box below. Please don't forget to smash the like button and the bell icon. If you have not subscribed to this channel yet, then please don't forget to subscribe.